Good evening, everyone. It is Wednesday, January 11th. We are getting together this evening with our tea. Stephanie, our lovely speech therapist, is going to be talking to us about pharyngeal dysphagia. So, Steph, you have a great topic for us today.
I do. I have a very good topic.
So we'll review last week's, which was oral.
Yes.
So make yourself a cup of tea. Yes. Join us. And also, I'm going to be making butternut squash soup, which we're going to taste, and we're going to go over some of the things in real time that Stephanie's talking about. So, starters, we have our anti-inflammatory green tea with brown rice. It's quite delicious. I don't think I've ever had it before. You may have given it to me once. I can't remember.
It's been a while.
It's really good. So grab your tea, and we're also going to hold on. Hold on. I got this.
You do.
There's a button right there. Okay. Sorry about that. We're trying out a new computer today because our one last week was not working super well. So I'm going to get started on some butternut squash soup. We're also going to add a little bit of tofu to it because we're doing a more vegetarian vegan style, and we need some extra protein because our people that have dysphagia really need that protein so they can rebuild those muscles and strengthen those muscles. So I'm going to get started on the soup.
Sure. I'll talk a little bit about, just very quickly run through the oral phase dysphagia that we talked about last week. We talked about lips needing to be strong enough to hold food in. We talked about the cheeks and being able to hold food, keep food from filling the cheeks, chipmunking your food. So your cheeks have to have enough tone in them to be able to maintain the food between the teeth, and so that the tongue can move it around. Obviously, the tongue is very, very, very vital in the oral phase of swallowing. Just FYI, did you know that the tongue is the fastest moving muscle in your body?
No, but I believe that. It makes sense. So last week, I think it was after we did our live, Stephanie said, okay, so anchor your tongue to the front of your teeth when you take that bite, and then try to get the food back to where it was. And I almost spit my food out because I couldn't. I need my tongue. You need your tongue in order to maneuver food around your mouth. So when someone has a stroke or
weakness in their tongue, that's what I was trying to simulate through having her do that, is to see what it's like to have food in your mouth and not have the ability to move it around with your tongue.
Oh, it was awful. And I, of course, giggled because it was uncomfortable, and that was my reaction to that discomfort. But how many people go through that? So very, very wonderful exercise. If you're curious, try it the next time you eat so that you can understand how important that movement is.
Right, but before you choke, please go ahead and use your tongue. Don't leave it anchored.
Correct.
Anyway, so lips, tongue, cheeks, jaw, all very, very important in the oral phase of the swallow. So tonight, I'd like to talk a little bit about the pharyngeal phase. The pharyngeal phase is really kind of where all the magic happens. So what I'd like to do is just talk with you about what it is that we as speech pathologists look at and evaluate to see how the muscles of the pharyngeal phase are working for you. So first thing that I'm going to look at is how long does it take you to initiate a swallow? And this is after the oral phase is complete. So once the food reaches the point where the base of the tongue, the back of the tongue could and should swallow, get the swallow initiated, how long does that take? So the way I get people to simulate this is Okay, so I want you to swallow some of your saliva now. Swallow again. Swallow again. Swallow again. Swallow again.
I don't know that I can.
So do you see how that initiation, it's like, it's because you fatigued that muscle.
Yeah.
So people with dysphagia may have that with every swallow, is that they have to really work at it to get the swallow initiated.
And my mouth got drier and drier and drier.
Well, because you don't have anything in there.
Right.
Now, if you had a
Food.
sip of liquid or food, it wouldn't be as dry. But that's the feeling a person with dysphagia will feel if they cannot initiate or have difficulty initiating the swallow. So that's it gets you. It helps you to understand that initiation, because the tongue has to push up. The base of the tongue has to push up to the roof of your mouth to get the swallow initiated.
That comment I made about discomfort, that whole thing was very uncomfortable, I guess is the word I'm going for.
It is.
So I threw some onions and some garlic and some olive oil. I'm also going to toss in an apple, cored but not peeled, because I'm one of those weird Whole Foods dietitians. And then we peeled, cut up, and roasted butternut squash. I think you can buy pre-diced cooked butternut squash. I just couldn't find any at the grocery store I was at. So I roasted this with a little bit of olive oil and salt and white pepper for 45 minutes to an hour until it's nice and soft. So I'm going to add that into this, and we're going to add our liquid.
I also think that you can get it frozen. Chunks of frozen, then you can roast it.
That's what I was meaning. Yes. Thank you for clarifying.
Okay.
Yes. So we're going to throw all this in, and then once it's soft, we're going to puree some tofu and add that in. Has no smell to it, so it should just totally absorb all of the. So you know what? I don't even know if I'm going to blend it, because I'm going to use the stick blender in the pot to blend everything. So I'm just going to throw some of this in here as we go.
Let's just talk about it. So this is, all we had was extra firm tofu. So silken tofu would be smoother if you need super smooth. I'm hoping that this is going to blend up smooth.
I think it will.
I think it will too. It's tofu.
Yeah. So you can use chicken broth, vegetable broth, whatever is best for you for this as well. So, all right.
So, next thing that we look at when we're evaluating the pharyngeal phase of swallow is laryngeal elevation. So, the larynx is essentially your voice box. It is the Adam's apple. So, behind that Adam's apple is the vocal cords. So, that's why they call it the voice box. What we're looking at for a swallow is that we want, or what's necessary for a good functional swallow is that the larynx has to rise and go forward a little bit. And the reason for that is because it needs to move muscles and structures in a way that it is helping to, I want to say close off, but it's not necessarily close off, but helping to eliminate the wide open space into the airway.
Okay.
So by the larynx rising and coming forward, it's closing off the airway so that the food has a better chance of going down into the esophagus.
Let me give this a quick stir. I like this. This is our little model, because I am not an expert in these structures like Stephanie is, so I sometimes need to look at this in order to understand what is happening. So your larynx is up here, right? So this is your airway right here. Let's see if I can move this closer. This is your airway right here. This blue structure right here is the epiglottis, and when you swallow, it goes down to cover so that the food goes down this smaller tube in the back. Okay. So the larynx in the front here has to rise and fall.
Yes.
It
actually goes up and forward a little bit. So what that's doing is it's helping the epiglottis to have space to come down and close off the airway, or at least limit the amount of space that food or liquid could go through for so that the food can go down through the esophagus.
Okay.
It's a very important part of swallowing.
Sounds like it.
So we'll look. That's something that your speech pathologist will look at. How high, how much movement does the larynx have? How effective is it? We're gonna look at the actual swallow. How many swallows does it take for someone to get down the amount of food that they took in for a bite? So some people take very large bites and they break it up into smaller pieces. That's not what I'm talking about. I'm talking about how many times do you have to swallow to actually clear what you're feeling in the pharyngeal area. We will count the number of swallows.
Okay.
that you use. Some people will then tell us, well, it feels like it's stuck.
Okay. So when it feels like it's stuck, and they point to where it's at. So I feel like, Stephanie, that the pasta that I just ate, it feels like it's stuck right here.
Right.
Where is it really?
So it's not right there. So there is a referred pain feeling, or not pain, a referred feeling. So typically where you feel it, it's going to be a few inches, an inch or so above.
Okay. So
where
if
you
I
point.
feel it here, it's probably
Well, that's more than an inch. But if you feel it right here, it's quite likely around here.
Okay.
Okay?
Okay.
So where you feel it stuck, if you feel it stuck here, well, you probably wouldn't. It may be there because there's not much above that. But
that's like the base of the tongue, right?
Correct.
Right in there.
So it could be that you have
So like
residue.
Right here-ish?
Yeah.
So like right here-ish. Okay.
Right. So that space behind the epiglottis is called the vallecula, and frequently things get stuck there.
So it's like a pocket, could you say?
It does. Well, it opens up as the epiglottis flips down.
Okay.
That pocket opens up.
Okay.
So everything is supposed to go down or is squeezed out by the strength of the muscles in the pharynx.
Okay.
So the posterior pharyngeal wall has to move forward. Yep, that's the back. The back side.
Okay.
Posterior pharyngeal wall has to move forward.
That way.
The epiglottis has to flip down. And all of the muscles have to contract to get everything down this very small
opening.
So there are a series of movements that are very precise, and they have to be in the right order for the food to go the right way. Most people, I'd say the majority of the population, don't even have to worry about that process.
Right.
About that coordination, about the steps being in the right order. But for some, it's not in the right order, and
Right.
we have to work on that.
Right.
So another thing that I look at is what does someone's voice sound like after they eat
Okay.
or after they take a bite?
Okay.
I'm listening for a gurgly sound, a wet sounding voice. So if you think about it, the food and liquid does not even go near the vocal cords.
Right.
It's not supposed to. So if we're hearing a gurgly, wet sound after someone swallows, the risk of that being in the wrong area or near the wrong area is great.
Okay. So what you're saying is, because this would be like the larynx-ish right here, right?
Right here.
Right? Okay.
So this is the vocal cords right here.
So the food is not supposed to come in here because this is where you breathe.
Right.
So what you're saying is if you're hearing that wetness in the voice, it's because that is too close to this area, which means it's in the wrong tube, basically.
Well, in the wrong tube or near the wrong tube.
Okay. So it could be back, back.
Right.
Moving
So if you
that
think about it, the
direction.
vocal cords have to vibrate to make sound.
Yep.
So it's actually vibrating other structures in your throat as well.
Which makes sense.
So it could be, this whole area could have residue.
Okay.
And that may be what we're hearing, the wetness.
Okay.
But after you swallow, there shouldn't be any more wetness there.
Right.
That's what concerns me, is that we've got to get that out.
Right.
Because if the next bite has more leftover wetness and the next bite has more leftover wetness, what you're going to have is an aspiration event when you try to breathe, because then once there's no more space, and that's the only time you stop breathing is during the swallow. So
Right.
after the swallow, if you're wet and gurgly, the risk of that going down into the airway is greater.
So what do we do?
Well, the first thing you should do is clear your throat. Clear your throat and swallow again. There are special maneuvers that I teach that is about clearing your throat and swallowing again. Now, for some, they have to hold their breath before they swallow so that we're closing off those.
So this is very specific to the person.
Usually it's very specific
Okay.
because it depends on where I'm hearing things, what the delay of the swallow. The next thing I was going to say, if you're coughing, are you coughing on things before you swallow, during the swallow, or after the swallow? Because that tells me all three are different things going on. So when the cough happens is very important to know.
That's great information.
Yes, and one other thing that I want to bring to your attention is, and this is probably the part that most people don't realize could be related to a swallowing problem, is that when food or liquid is touching spaces in your throat that it should not touch, you could potentially at that time start having watery eyes. You could have a runny nose, because that is the body's way of protecting itself. So if something is in the wrong place, say a fly gets in my eye, or a bug gets in my eye, or an eyelash gets in my eyes will water to try to wash it out. So what's happening if you are having watery eyes, if you're having runny nose, sometimes it's an influx of saliva trying to wash things out of the wrong place. So all of those things, not necessarily are they a sign that it's a problem, but it could be. And your speech therapist would have to put together all the other symptoms to try to figure out what's going on with that. So that's an important.
Yeah, and
part.
so we had talked a little bit about this before we started our training, just so that I would have a better understanding of what was going on, because I have a basic understanding, right? I know how to incorporate the nutrition into this. So when you told me that you could be coughing before, during, or after, that thought had never crossed my mind before. So it's really interesting to think about why things are happening, because typically if I cough, it's because I inhaled when there was stuff in my mouth, and I shouldn't have. I knew better, but I end up coughing to protect my airway from what could have come in my airway. But it never dawned on me that someone else could be coughing at the end of the swallow, and that's a totally different issue.
Right. So if you're coughing after the swallow, after everything's out of your mouth, and you start coughing, it could be because there was so much residue in there that it spilled into the airway after you swallowed.
And your body's trying to protect itself and get it out.
Absolutely.
Okay.
Coughing is a sign, but it's not a bad thing.
It's a good
thing. We want you to cough. Mm-hmm. Like I said last week, I've had patients that have tried to pretend they weren't coughing, and they try to hold back a cough. I want you to cough.
Right.
Because that's what's getting it out of the wrong place.
Maybe cough into your napkin, especially if you're around people. But cough.
Absolutely cough. So the last thing I'd like to talk about is with the pharyngeal phase of swallow is regurgitation. So regurgitation could initiate at the esophageal level, but it affects the pharyngeal level. Or we could have some regurgitation from the pharyngeal level up into the nasal cavity.
Okay.
Because the muscles of the pharynx aren't able to keep it from going through the nasal cavity. So it starts at the pharyngeal level for a nasal regurg. Okay. But other regurgitation may be because the esophagus can't move it down, so it's bouncing back and forth, and you may feel it coming back up.
Right. Which is never a good sign.
No, it's not, and that's something that we would talk about. Needing to go and see a doctor about, and maybe taking certain medications that would help to prevent that. But we'd need more information about it.
Yes.
But that's a possibility as well.
Interesting. Okay.
There's a lot that goes on at the pharyngeal level.
Yeah, it's so complex, and I see diagnoses a lot of oropharyngeal dysphagia, which means you have both, right? Both oral and pharyngeal, and the way they're interacting is not appropriate necessarily. That may not be the correct word, but it's the best one I could come up with.
It's not right.
Right. So you don't necessarily see pharyngeal esophageal. You see oropharyngeal, and then you see esophageal dysphagia. So it's so complex and so difficult. So I'm learning so much with these talks as well.
Yeah.
So does anyone have any questions? Are we able to see? I see there are 2 people on. I see someone said,
it would be over here.
Please say hello. We'd love to give you a shout out. And yeah, soup is boiling away, so I'm going to grab the immersion blender or stick blender, and I'm going to puree it, and we're going to see how it tastes. It smells good. So we used a garlic-based broth.
Yep.
You could use vegetable broth if you're going vegan. A couple of the recipes I saw also included other veggies like celery and carrots. It's totally up to you if you want to do other veggies. A couple other recipes also added either cream or vegetarian-based cream like coconut milk, or you could even do like a creamy cashew milk, almond milk, something like that if you wanted a little bit more smoothness in there. We're not going to add cream or any other dairy alternative to it. We're just going to see how we do.
Well, I think the tofu blended is going to make it somewhat creamy.
Yes. So, okay. Put this together. And I'm going to turn this down. I'm going to make sure I have this on here right too. There we go. Okay. So,
So Alyssa Goodo asked, could you explain the differences between dysphagia at the different places, oral versus other places? So yes. So oral dysphagia is about the muscles of the oral cavity. So lips, tongue, cheeks, palate, soft palate, when we're seeing weakness or coordination deficits at any of those points in the oral cavity, that's when we would have an oral dysphagia. So pharyngeal phase dysphagia is more about the pharynx level, so the level of the pharynx, so which is behind the oral cavity. So the pharynx, so this is the tongue, so this is the tongue here. The pharynx is behind the tongue and down to the level of where, down to this level here, essentially where the choice, the difference between going down the esophagus and going down the trachea airway, that's where the pharynx stops. So a pharyngeal level dysphagia would be at the base of the tongue down to the level of the, almost to the vocal cords.
And this is involuntary, correct?
Well, so I can't say I want you to move your posterior pharyngeal wall. So that is true.
Right.
However, there are exercises that I can give people that we can set up and do for the muscles of the pharynx.
Okay.
So which is very different than the esophagus. There are no exercises that you can have to improve the movement within the esophagus. At the pharynx level, we can.
Okay.
You can't consciously move it, but we can do specific maneuvers and exercises. Some of the exercises are speech sound related. Base of tongue exercises are, he's going to get that.
Hey, go lay down.
So though it's not voluntary control, it is, we're able to exercise it.
Yeah.
So that is the difference. Does that help, Alyssa?
Okay, I'm gonna blend a little bit more.
Okay.
Our mascot has decided he needs to be involved, so trying to get him to calm down. Okay, she said yes, thank you. If you ever have any other questions, I can't quite read what that says.
Yes. Have you seen dysphagia caused by stress? Yes.
That is a fabulous question and one that people need the answer to.
Yes. So, Alyssa, that is such a good question because that's a topic that's very difficult for many therapists because there's not a whole lot of research on it yet. But we went to a conference back in November and we learned a lot about that. It's called functional dysphagia. So it's not oral, pharyngeal, or esophageal, or it's all of those, or it's...
So basically what they call it is a dysfunction of the gut, brain, and the way they interact. So because your digestive system includes not just your stomach and your intestines, but also your esophagus and your pharynx and your mouth, these are all connected.
Yep.
And the way our brains work and process everything, stress, food, emotions,
yep,
it's all connected, and all of what you go through mentally can affect every part of your body, including your structures that allow you to eat and swallow.
Yes.
And digest.
Yes. So if you think about your brain as the computer, the motherboard of your entire body, it regulates and manages everything.
Yes.
So when there is stress, I don't know if you've ever heard people say, I carry my stress in my back. I carry my stress in my shoulders. I get migraines when I have stress. Well, the same thing can happen with dysphagia. You can have difficulty swallowing because that's where you carry your stress. There are things that we can do that can be done for that. You just need to find somebody that understands it.
Yes. Yes. What's the next
really
question?
Good question. Oh, wow.
Yeah.
Thank you for the information. My dysphagia started this past August due to silent reflux.
I hear that all the time.
All the time.
As well. We hear that. I shouldn't say I. We hear that all the time as well. And that is something we can address also. I specifically address the reflux through food and what you're eating and what changes you can make to limit that amount of reflux, because whether it's silent or not, it will cause problems in the long run. So we want to mitigate those problems as soon as possible. Preferably, I would love to catch people before they end up with dysphagia, but most of the time you don't know you have a problem until it's affecting here.
Right. So there are so many things that reflux can do that will affect swallowing, and one of those is that it changes the mucous membranes. So when there's acid constantly over the mucous membranes, and depends on how high up your reflux goes, you can aspirate reflux at night while you sleep. So it can go all the way up into the pharynx and aspirate into your airway. And that is a scary proposition, but it can happen. And if you think about that acid, that it has no business being there,
right, and
what it does to those mucous membranes. Remember, we talked about how important it is for you to have moist mucous membranes, and that's what salivating when you smell something good is all about. That's your mucous membranes getting ready to eat. Mm-hmm. Again, that's part of the brain. That's the brain is handling all that.
Right.
But if that reflux, that acid reflux, is tearing down the walls of those mucous membranes, you're not going to have the necessary moisture to be able to swallow things.
Right.
And then you start compensating. So you're using muscles in a different way to compensate for that lack of moisture. And that's when the spiral starts.
Yes.
Everything. So then you're not in the same coordination or order of the muscle movement for swallow. So much can go wrong.
Yes.
I hope you're not there, Stephanie.
We'd love to talk to you, so maybe
Yeah.
send us a private message, and we'd love to follow up with you. Alyssa has another really good one.
Thank you so much. One last thing. With functional dysphagia, I can't just force myself to not be anxious, true, and then swallow. It's a process of exercises. It's a process of exercises and treatment. Do you have exercises and treatment that you've been given for that, Alyssa?
I also want to say, anxiety is not something that you can just will away.
Nope.
I myself have anxiety, and it's something I've been working through. I highly recommend you find a good person to talk to, a therapist, preferably a professional. It's great to have friends and family to talk to, but they can't always see what's going on from an objective level. So it's really important to find someone to talk to. Medication can help. I was on an anxiety medication for a little less than a year. My job was really, really stressful, and it helped tremendously. Did it make it go away? No, but it's also about working on your mental health, and one of the things that helps your mental health is eating properly and eating healthy, because your gut and your brain are so connected that what you put in your gut directly affects your brain power and can affect your mental health. So whether that's anxiety, depression, etc., sometimes they say that your chemical imbalance could be caused by a mineral or a vitamin deficiency, which is something that we try to work through and address. So it's not just a simple thing to address, which is why you've probably been told you're fine, there's nothing wrong with you, just go home and eat and you'll be fine. Well, it's not that simple. And you and I both know it's not that simple.
It's not that simple.
And you need healthcare providers that are going to listen and look at you as a whole person and not just either your anxiety or your difficulty swallowing or your just, they can't look at just a snapshot because that's not who I am. That's not who you are. We are complex. I didn't get it blended all the way. I feel like this got into a really important part of the conversation that more people need to talk about. So we'd also love to talk to you. So please maybe send us a message or give us a call or text us. Do you want to, actually, maybe I'll put it on here. I'm going to put our number on here.
Yeah, just text us.
Hold on. I got to make sure I have the right. Okay. So you can send us a message. That's our business number. We want to help you have a sense of calm and comfort when it comes to food, because food is not meant to be stressful, but it is, because food is so ingrained in every part of our lives. It's a very social thing. It's a very emotional thing. It's really important that you feel comfortable eating. So that's something that we address. So yes, Stephanie looks at all of these things and how everything works together. And my job is to make sure that based on where you're at right now, we can get food and liquids into your body so that you can start to heal, and so that Stephanie can work with you to help strengthen those structures, or not. Maybe it's not strengthening that you have an issue with. Maybe it's coordination. Maybe it's,
we have to do a full eval to figure out what kind of things we can recommend.
Those are such good questions, and we really appreciate you telling us. So no, you can't just force yourself to not be anxious. Oh man, I wish that were a thing.
That
life would be so much easier if it was.
Yeah, it would. But we're here to talk you through it and talk and understand more of what you're dealing with, and so we'd love to talk to you.
Sometimes it's just about getting you to feel better in your own skin, because we all know that being human is really difficult, and we are faced with problems all the time. So on that note, I'm going to finish blending this soup. If you have more questions, please ask them, and then we're going to taste this and see if it needs to be seasoned or anything. So I'll be done in a minute. Okay.
All right. Is there anything else I can do while you're finishing up?
I think I just need a little more liquid in here. So this is the thing. It's pretty thick. If you needed a thicker consistency, where it's at right now is probably good. If you need it thinner, you can always add more liquid, whether it's water or broth or whatever. So.
All right. So tonight we talked about the oral phase. We reviewed the oral phase. We talked pretty intensely about the pharyngeal phase and what affects that. If there are any other questions out there, we would love to answer them. So ask away. If you would like a private conversation, you can either send us a message on Facebook, or we did put our phone number in the chat, which is 574-475-7285, and we do accept texts on that phone number. So please, by all means, reach out to us. We would love to talk to you and get down to the bottom of what's going on with you. So,
okay, this is not perfectly smooth.
Should we do a little bit perfectly smooth?
We're gonna need to do a little bit in the blend jet, yes. But I am gonna taste it first to see. And with the stick blender, the tofu didn't get completely blended, so it's got little white specks in it. But it tastes good.
Yeah.
But yeah, if you need it perfectly smooth, blender is the way to go.
We will let you know. We will do it.
I guess I could have chosen a bigger spoon, but that's okay.
It
You do. Yeah.
Do we have any left of the...
Nope, I used it all.
Okay, so a little bit of water, or do you want some oat milk, or water works?
No, I'm just gonna throw some water in here. Blend it. Ooh, sorry. Winston thinks he's gonna get some.
He's feeling better, so he's super hungry.
So you probably saw that I unscrewed the top after it started to blend, and that was just to release the pressure, because anytime you have something hot, it builds pressure and can explode, and we don't want anybody to get hurt. So that looks pretty darn smooth.
Yes, it does.
All right. Let's give it a try. So you're going to talk me through this pharyngeal level as I'm doing this.
Oh, that is so good.
You like it? The apple.
I want a bigger spoon.
Well, let me get you one.
I'm going to eat more.
Okay, so I'm salivating, so pre-oral. Put it in my mouth, and I'm going to have to get it to the back, so that's the oral phase.
Yep.
So, and no, I don't have to chew it because there's pureed.
Nothing to chew.
So I can feel my larynx moving.
Right. So, okay, do that again.
Okay.
I'm going to put my fingers here. So oral phase, oral phase, oral phase. And yes, so I felt the movement. Your swallow initiation was instantaneous.
Mm-hmm.
There was no delay.
Which it should be instantaneous. So if there's a delay, that needs to be addressed.
Right.
Okay.
So continue on.
And I'm making a video of the soup over there so that we can post it for anyone that wants to try it. I like it. And I think you can't taste the tofu in it. And I think it adds a nice silkiness to it.
It is silky.
And it increases the protein, which is so important if you're trying to get more protein in so that you can re-strengthen those muscles.
Wow, that's really tasty.
Yeah, I like it.
Will you put the recipe for these guys in the...
Yeah, I think I'm going to post it on YouTube.
Okay.
And so we'll put the link to the YouTube page with the recipe in there. So if anyone has any other questions, please do not hesitate to reach out to us. Even if it's something that you feel like is simple or trivial, it's not. And if you have the question and are concerned about it, I guarantee you there are probably thousands more people that have the same question. And when I say thousands, I am not exaggerating that.
Nope.
There are so many people that don't have answers, and not just in this country, as I'm finding out.
Across the world.
Across the world. So please don't hesitate to reach out to us. We are here for you. We want to support you. So please enjoy your tea.
Anti-inflammatory, because this is good for your gut.
And the rest of your body. And have a wonderful rest of your week. Still a couple more days to go.
Yes.
So God bless. Please reach out to us when you need us. We would love to be a part of your journey. And we're here. So please don't be a stranger. I'm Kat Ledwig.
And I'm Stephanie Pepper.
And we
are Dysphagia Duo.
Dysphagia Duo. All right. Have a great evening, everyone.
Good night.